Folks, meeting will start here in just a few minutes.
What it is proven is that a drug can block this virus. And I'll give you an example in a moment of why we think looking forward. This is very optimistic. The mortality rate trended towards being
We begin with Tim Murtaugh. He's Communications Director for President Trump's 2020 re-election campaign. Tim, it's wonderful to have you on this show today. There's no campaign for
Good afternoon.
a financial crisis, health. March 15th, a loss of $350 billion.
Hi, Mary Jo Vernon, Director of the Platte County Health Department. And just want to welcome you all to the meeting and ask everyone to make sure that for background noise, that you've muted your technology there. We're having some issues with feedback we're trying to get corrected here, so just hang on a minute. On your computer, volume all the way down. Need the agenda. Okay, I think we have everything corrected now. Can somebody reply back that they can hear me okay?
I can hear you fine, Mary Jo.
Okay,
I can hear you.
I can hear you, Mary.
Thank you.
I can hear you. Kathy Wright.
Thank you. All right, I think we have most of our group on, trying to keep track of everybody signing in. Hopefully a few others will join here in a little bit. Our health board did meet yesterday and had some healthy discussion over our moving forward plan, and it was decided, as you all know because I sent you out the amended order yesterday, that they did decide to move our stay-at-home order from the 15th of May up to the 3rd. And we spent quite a bit of time yesterday evening with our attorney, getting all the language of that order together before we send it out. But as you can imagine, there's no way that we can cover every single business in Platte County. So we've done our best, and we will be, providing clarification moving forward on any additional businesses. We are, as far as our response recovery and reopening plan that we talked with you all about on Monday, we're making, a few modifications to that as we move forward to give, some more specifics and more directions. And my assistant director, Dan Lubert, has been working many hours trying to get some business guidance. There you see it on your screen, to assist folks with making their plans. Dan, do you want to speak a little bit about that? Thank you.
Here. I hope to have this guidance done by the today. I really wanted to have it completed by the end of yesterday, but after hours, I was getting really tired. So anyway, I'm back at it today and hope to have it completed. But basically, guidance for various types of businesses. The first page is very general guidance for all businesses. The second page is for office-based businesses, and you can see over here the types of businesses we're referring to. The third page is for child care facilities. This includes both licensed and license exempt, both in-home child care. Does not include summer camps or public preschools or on public school campuses. Some of that guidance will be coming later. This page is for schools, pre-K through 12, and then this one is for higher education. For field services and real estate, down here you can see the list of businesses that would be covered by this page, and these again are general guidelines. Limited healthcare settings, and you can see that includes, for example, chiropractors, fitness centers is in this list. And then on the next page is nursing homes and congregate care facilities, which we need to be very, very strict that they are to have no visitors except under very limited conditions, like some end-of-life scenarios possibly. Personal services, this includes things like pet groomers, pet handlers, and so on. You can see the list here. Local and personal recreation, we will continue to ask, at least through phase 2, tier 1, that playgrounds continue to be off limits, but parks can certainly be open with social distancing measures in place. And then here, these next 2 pages are for retail. Again, these are guidelines. We expect every business, frankly, to create their own reopening plan. And with that being said, I want to show you on our web page a few changes. Here's the order, so everybody can see that. Now, this order is applies to phase 2, which we will enter on May 4th, tier 1. A new order will be issued each time we move to a new tier. There are 4 tiers, and the triggers to move those tiers are, well, you can read those triggers on the plan itself, which is on the web page, looks like this. And then if you'll read under the guidance for businesses and organizations, that has some of the requirements for various types of business, or all businesses and organizations have to create a reopening plan. The food establishments must submit their plans to us, and there's the email address where they can do that. All businesses will be expected to post a plan summary on or near their customer entry door. And the plan summary must include measures that are being taken to protect both employees and customers. We are asking that businesses and organizations, all of them that have customers that come in, that they collect names and phone numbers of those customers in the event that contact tracing becomes necessary. There's one thing that is working well for restaurants is the fact that the National Restaurant Association has created some very good guidance for them to create their plans. See at least the opening page, but it's a very good document. And I'm sure there are a lot of other organizations that have created similar documents based on, what the profession is. And I also wanted to point out that the recordings of the meetings will be here on this webpage. So if you want to relive Monday's meeting, you can certainly do that.
Okay, thank you, Dan. Our
Can I-
Platte data, Aaron, we've received one additional positive case since we all met on Monday, so that's staying at a low count, which is very good news. I think I just at this point would really like to go ahead and address the church question that we have had. And I've asked our attorney, Jen Snyder, to make some comments about that.
Sorry, I don't know if anybody can hear me. My name is Jen Snyder. I'm a local attorney in Platte County. I'm a local business owner. I am a resident of Platte County. And I want to preface the conversation by letting everybody know that I'm also the senior warden of my church that's at 45 and 9 highways in Platte County. I'm on the board of directors for my son's competitive swim team, which is also affected by this order. And I also happen to have a high school senior at Parkville South who's suffering from the same complaints and concerns and heartache that a lot of other people have mentioned. So I certainly appreciate the opportunity to serve the Platte County Health Department, but I also want all of you to know that I think I have a pretty good understanding of the concerns that you might raise in regards to spectrum and non-sexual abuse. There's been some concern raised about whether or not churches are being treated, I guess I would say fairly or equitably, whatever word folks might want to use. And I'm happy to answer questions about that. I do want everyone to know that legislation is viewed and reviewed by our courts to make sure that the regulations are neutral as to all entities that are being regulated. So long as the legislation is regulating the activity and not specific groups performing the activity.
You're coming across muffled.
Oh,
Yeah.
well, I'm going to go in front of a different.
Mary Jo, I think she's coming through your microphone.
I don't know if anybody can still hear me.
Oh, that's much better.
Interruption. Okay. Well, I'll try to start over again.
No, go ahead.
Okay. So what we look at is to ensure that our legislation is narrowly tailored and has a compelling state interest. Obviously, right now, compelling state interest is public health and safety. And as long as our regulations regulate activity and is evenly distributed among groups, it's going to be upheld by our courts. And therefore, we are, and this particular order does not separate a church as an organization versus a group that is not a church. It is restricting the activity and the number of people participating in that activity. The other CDC guidance that is still present on mass gatherings indicates that regulation should take into consideration those activities that will likely draw or otherwise have vulnerable populations in attendance. I think most of us would understand and also appreciate that specific events such as church, funerals, weddings, maybe even high school graduations would draw family members or people who are in that vulnerable class. And therefore, the other compelling state reason that we have for regulating groups would be to also look at those activities and that would draw large groups and also the vulnerable population, which is our groups 60 and up. So that being said, I think I'm happy to answer any questions to the best of my ability.
Mary Jo, I have a question.
Does anyone have any questions regarding the?
Mary Jo, I had a question for the. I had a question.
You can go ahead.
Okay, I'm sorry. I understand the rules that you're talking about, where faith communities should not be required to adapt to mitigation standard more stringent or other similar entities. I guess when you classify a church as something separate than a business, then my question is why separate a church that are different than a business that has as many people as you might have at a church, at the business. So what's the difference?
Well, in this particular instance, the other compelling interest that the health department has is ensuring that its restrictions do not otherwise have an adverse effect on the community at large. And right now, that other secondary compelling interest is the status of our economy, and therefore they have to differentiate the retail businesses versus the churches. The other distinction between businesses and churches, depending on the very specific comparison, would be the length of time that someone may be in that particular instance. There is also, arguably, depending on what institutions you're looking at, activities that would require physical proximity closer than 6 feet that may occur in a church or an organization like a sporting club that
Can I add in as well, Joe? You know, our big box stores like Lowe's and places like that are regulating the amount of people that you have X amount of people coming out of the door. In churches, that's not the case. There's what we call ingress and egress. Everybody comes into the building and out. And you know, we're not at all trying to single out churches. We're trying to, we said this at the beginning, we're trying to slowly reopen things so that we don't cause a huge spike in our cases. As Jen said, you know, we're trying to protect the at-risk population who will definitely be at church. And if we don't do this slowly, methodically, we're going to be rolling things back to the to the stay-at-home order that we've been under, and none of us want that. You know, I just want to remind people as well that up to 48 hours prior to becoming symptomatic, you can have the virus and be able to shed it. So people could be coming, you know, to church, 6 feet apart from someone, but still, you know, a couple days later, down with the virus. And I just want to bring to the forefront as well that there's a rehab center, a Riverbend Rehab Center in Kansas. That one employee came to work and was ill, and as a result of that, 120 people in that facility contracted the virus, and 20 deaths have resulted from that. This is the type of communicability that this virus has that we are trying to prevent from large gatherings, regardless of the origin of the gathering. I had a church get a hold of me last night and ask if they could drive a parking lot. That's a great idea.
Mary Jo, this is Dagmar with Platte County. Could I ask a question, please?
Certainly, certainly.
And I don't know if this is for you or Ms. Snyder, but I appreciate the explanation that Ms. Snyder had given about high-risk populations, and that's a major concern for organizations and businesses who actually cater to very, very low-risk populations. Was wondering if there might be a loosening of restrictions. And a specific example that I'd like to give is, for example, a gymnastics firm where they have almost exclusively children and teenagers that are usually serviced by very low-aged coaches in a very, very large environment that can be easily sanitized. So giving that as like a specific example, is that possible for other organizations that tailor their service industry is mostly given to that low-risk group? Is it possible to have a loosening of restrictions?
Before we answer that, can I ask everybody who is on the call or on the go-to meeting to mute yourself until you're ready to talk? It's causing some feedback. Thank you. You know, I'm looking possibly for other people to chime in here. Just because people are at low risk for severe effects from the virus doesn't mean that they can't contract the virus and maybe show low symptoms or no symptoms and then take it home, you know, to individuals that either live with them or that they're going to be around, you know, like parents, grandparents, those types of things.
So this is Dr. There's no way to keep 100 kids going to a gymnastics facility from, you know, seeing their grandparents afterwards, or you know, going to a friend's house and they have aunts and uncles there. So I mean, I think it's really hard to say, yeah, let's give this facility a lot more permission to have their enrollment way up, and these facilities like churches to not have that. I mean, I think that it should be more of a blanket statement. If you've got a lot of people that come in, that's where the risk is, because you don't have any control over where those folks are going after.
Ms. Wood, this is Jen Snyder. I completely appreciate the question very much. I have a similar concern at my household, but from a legal point of view, when we make variances, like in planning and zoning matters that the commission might be aware of, or other governmental functions, we have to be very circumspect in doing that and ensure that the reason for a variance, which is essentially what you're describing, has a real rational purpose, again, narrowly tailored, and is not overly favoring one particular group. I think any governmental body, including the health department, needs to be very careful to treat all groups as evenly and as equally as is possible. And while the human instinct to want to make these variances in this very difficult time is great and very kind-hearted of people, that is not what a government really is cut out to do. And I'm sure you can appreciate that in your role with our commission.
And this is Mary Jo again. I just want to remind everybody, this is tier 1, step 1 in relaxing this very slowly so that we can move forward and continue to go to the next step, the next tier. We can relax more. How we maneuver through this is going to determine whether we're able to move slowly to the next tier in a month or whether we have to roll things back. I know, as Jen just said, you know, it's human nature. We've been under an order to restrict our movement for quite some time now, but we just have to hold on and assure that our cases don't spike up, because I personally do not want to bear the consequences of this disease spiking in Platte County and we start having deaths that we haven't had.
Mary Jo, I think everyone understands that we're all trying to do the best thing we can for the county. I would like to draw your attention to what Kansas City just put out when you get a chance to look at it sometime today. They do allow some type of church activities, and I think that's what folks are just looking for is a chance to safely, and that the churches, you know, they don't want to hurt any of their folks either. So I just let's really try to look at a way that and maybe not be so legalistic about, you know, definitely you have the power to shut people down, but you should have the responsibility to use that power as little as possible, especially if churches can do this safely, which it looks like Kansas City may, and obviously you're going to have to look at that information, may allow that. Thank you.
Sure. This is Mary Jo again. I truly appreciate what you just said. Actually, we were watching Mayor Lucas and Dr. Archer right before this meeting started, and you know, we are going to look at the Kansas City plan, how they're rolling that out, and you know, are most definitely willing to take a look at our plan. You know, the issue is there's not time for everybody to make all these decisions and then communicate with each other. You know, we we didn't know that Kansas City was going to announce this today, and it's just just something that we're trying to take time to look at, and once again, we've not dealt with this before. So Kansas City, all the counties around, we're all trying to come up with a reasonable solution. So
this is Jen Snyder. You are correct. We were watching something scroll across the TV screen and trying to take notes to see what the city of Kansas City was saying, because I do also recognize that a portion of Platte County is Kansas City, and that'll make it difficult for the groups operating in that area to really know how to move around. And in an ideal world, we would not have different temporary regulations. So if any of the people on the call, especially our clergy, but including everyone else, has a time to look at the city of Kansas City's order and the dates associated with that order, and the certain numbers of bodies that I think I saw was 10 people inside or 50 people outside, it would be valuable for us to understand what the opinion of the group is about those restrictions. Obviously, there are some churches that can pull off an entire congregation with 50 people outside, but I would speculate that there are likely many groups that are much larger than 50 people. That may be something that those groups have to deal with and have services and shifts if that were something that we were to look at, but it would be very appreciated if some careful review and feedback on the task force website email. That would be great.
With all due respect, I appreciate what you're talking about, but as soon as a lawyer starts talking, it changes the discussion of the community drastically. You start talking about the limits to your power, where I don't think we want to be discussing that. I think we want to do some common sense things and stay at that level and not get so legalistic about taking someone's First Amendment right away. In Platte County versus in Kansas City, I can go to church, but I can go to the restaurant over in Parkville. So I would like you all to go relook at what Kansas City did and then come back to us about what you're thinking about relaxing for churches. I don't think we need any more legalistic discussions about that for this meeting. That's my opinion, of course.
thank you. How about other members of the group? Any more comments on the Kansas City order, our order? Any feedback you'd like to give us?
This is Bob Locke.
Hi, Bob.
One of the comments I thought was very interesting and I think very appropriate that was just brought up was the protection of vulnerable populations and high risk folks, and it followed Dagmar's discussion about low risk people, and I my concern with some of this discussion, or what I wish to emphasize here, is that I think we need a little bit more of a surgical approach to some of this, to the degree that we need to protect high-risk populations. I think we should do everything we can to do that. Regarding low-risk populations, I think even if they're found to be confirmed with the disease, and we may have very small severity of that, and I think the measures and the metrics that we use to analyze this need to be a little bit more surgical, rather than just raw data that is maybe overkill in some situations and underkill in others. And I hope as we progress forward in this discussion that we're able to modify the metrics so that we can protect the people we need to protect without stopping the entire operation of businesses and whatever. It may not, and gymnasiums for kids, whatever. We don't need. So that's what I'm thinking.
Bob, this is Dagmar from Platte County. I would agree, and I guess that was kind of more my thinking when I mentioned the example of a gymnastics firm, is that, as just using that as an example, there are companies out there that cater to the low risk group. And maybe when we go into the next phase, if we don't want to amend this phase now, maybe we think more like opening things up more for people with low risk, or we let people decide, if you're low risk, maybe put, I know you've got signs out in front of some of these establishments, just some kind of caveat that about the risk of certain age groups or something on there, and then letting people decide that for themselves, or taking a more surgical approach, I think, because there's a lot of businesses out there that are going to go under now. Just even though we are, and I really appreciate, pulling back on this order to May 4th. I think that was a great move. But I think that, I've talked about how unemployment rates, when you have people that lose their jobs and have that stress, that impacts health as well. And sometimes it's even more so. So I would, as much as we can do to preserve people's lives, both those that are being impacted directly by the disease and indirectly by the disease, and that has to do with restoring businesses in as safe and quick manner as possible. I think that to me has to be the priority, and that includes churches as well, and nonprofits.
Hey, Mary Jo, this is Steve Hager. I'm sorry I was a little bit late getting on. We were having a meeting at the hospital about reopening as well. This morning I was part of a panel for Safe Return KC. Did you guys talk about that and the documents that they are providing?
No, we have not, Steve. So if you would like to enlighten us, feel free.
Absolutely, and I'll send a copy of it to you so you can share it with the group. But Mid-America Regional Council, the KC Chamber, KC Area Development Council, and the Civic Council of Greater Kansas City put together a safe return document, about 19 pages. It outlines the 3 different phases of reopening and some basic ideas and guidelines for businesses to follow to do that. Now, obviously, the county, you as the health department, will put out the requirements, but then these are some applications that they can use to reopen and some thoughts behind how to do it safely.
Great, thank you, Steve.
Absolutely.
Steve, this is Dan with the health department.
Hey, Dan.
Hang on just a moment. I was going to ask you do you know, is that document available online?
It should be. They were saying it would be available on those 4 different organizations on their websites. And I can, if you give me a couple minutes, I can pull up a link to it as well and send it.
Because that is,
I'll work on that as you guys go.
It's new for all of us. So finding documents like that to use as templates or guides is very helpful. And if we have something happening locally already, that's wonderful. That has been a big challenge, finding good guidance for a variety of types of businesses. So I would certainly appreciate that.
Absolutely, and it very clearly says to follow your local jurisdiction's requirements. But then here's some information on how to, you as a business owner, how to get back up and running.
Other members of the council, anybody have feedback, comments?
Mary Jo, this is Rusty Savage. I kind of wonder, will we proceed tier by tier? Is there any possibility of skipping tiers and moving from gatherings of 10 to gatherings of 50? Are we going to have to go stepwise through that? And are we going to have a hard month in between each triggered tier in order to make changes, or will it be more liquid than that?
That is a very good question, Pastor Rusty. I just want to remind everybody, we being the country have never done this before. So we're just trying to move as safely as we can. We will be monitoring, every step of the way. Our board has agreed we typically meet once a month. Our board has agreed to meet on the 12th of May for an additional meeting to, reevaluate everything, but we just have to be cautious. One incubation period is 2 weeks. We talked about this on Monday. That allows individual A to get exposed and become symptomatic, get tested, and get results. You can't tell a trend in one incubation period. So if we skip phases, and I appreciate your question, Rusty, but if we skip phases and move too quickly, then a week into, rushing on ahead, we could have 1,000 people that have it. Then what? Then we're going to be, nostril deep in trouble and then we're going to have to, I just threw that number out. Don't hold me to that number, but I'm just trying to say, then we'll have to roll back to the stay-at-home order. It's like now we've got people that are sick, hospitalized, and dying. And I know these are all hypothetical situations, but these are the things that we have to be considering with a novel virus that we've not fought before. So, that's the answer.
Mary Jo, a comment on that?
Yes, James.
As an addition to Rusty's comment, when you read the plan, what that tells me is what the plan says is that 2 to 4 incubation periods between tiers, which is 1 to 2 months. I think what needs to be clear to folks, if you follow the plan, what that means is some things with large gatherings may not occur for 3 to 6 months if you go by the plan, right? And I think being honest with people that especially want to get going like churches to say, hey, look, the plan, worst case scenario is you might not be able to have a service with your normal crowd for 3 to 6 months if we follow the plan and everything stays good. I think that's an honest comment. It's honest information to put out to these people. Otherwise, they're trying to read between the lines. And it's about expectations management. And everybody sees everybody, and they expect to be able to open up as soon as they can. And I think it's vitally important that we be absolutely honest with people, and sometimes worst case scenarios, which I think you all do wonderfully, to let them know that, because that may be a shock to people when you tell them that 3 months or 6 months or 4 months. And they need to be prepared to understand why it's that long.
Right, that's a very good point, James. And, it is our goal to be transparent and communicate, all of this out to people. And that kind of leads into our next, marketing of this. We're going to need help to get this information out to people. Our best method is to, put it on our website, have links available, communicate through our chambers of commerce, all of our social media methodologies that we have at the health department, as the sheriff's department is willing to push things out. If you all know of methods to push things out into your community or your business arena, we would be more than happy to hear from you so that we can get this information out. And all of this being said, to go back to what James just said, as we move into the year, then we're starting to, get into fall, and that's going to be flu season. So that's going to complicate things as well. So to me, that's another reason why we want to move slowly and methodically through these phases and assure that our case counts are doing well, so they're not blowing up towards flu season. And then we have influenza to deal with along with still COVID, situation that is rising in our county. So,
Mary Jo, a comment on that, please.
Sure.
Are we basing this on raw case count numbers as far as increases in positive cases, or are we going by infection rate? And there's been a lot of discussion in the world about whether you go by infection rates, which are ideally you want to stay below 1% or 0.1%, however they read it. So which are we doing? Raw numbers of increases or infection rate tied to population percentages?
While my specialist is teeing up here, I also want to say that, as we're looking at a case count, there could be a family, a case is not just a case. There could be a family of, I'm just going to use a large number. I come from a family of 10, a family of 10 that in the same household would get ill. So that the epidemiology of this, you have to kind of look at the individual scenarios as far as just the raw case count. And now I'm going to let Erin take over.
Hi, James. This is Erin with the Platte County Health Department, and we are looking at both rates and raw case counts. And also we're looking at regional data as well, because as we've mentioned, we have a pretty small population in Platte County, so that's something we're considering. We've looked at the rates. Our rates for our county are pretty similar to Clay and Cass counties, and actually not too far below Johnson counties. Kansas, they have a much larger population than us, obviously, and they obviously have a lot more cases, so we are taking that into consideration as well.
This is Bob Locke. I've got a question on the metrics that you're referring to.
This is Mary Jo again. Commissioner Wood, is there any report at all on the disaster relief funds? Has the commission received any additional guidelines or information on that?
To date, we have not received any additional information on that, and I would just like to reiterate that we would like to use those funds to get our businesses back up and running again and our families back up and running again. So, but no other information, restrictions, guidelines, or anything has been given to us yet.
Okay. Thank you, Commissioner Wood. And I believe someone is telling me that, Bob, you were trying to add a comment.
Yeah, I had a question on and I don't know if this is ever going to change, and I'm new to this also, so I appreciate any input you can give me. One of the metrics that the only metric we're using, it seems like, is confirmed cases, which seems to be very subjective, and because there are, from my understanding, many other people that are asymptomatic or have such mild symptoms that it doesn't really matter that they're fully protected. So my question is, are we going to be a little bit more precise or possibly change the metric to address the things that are most important here? Because I know we got to protect hospitals, we got to protect those that are high risk, and one of the ways of doing that is maybe to measure hospital beds on a regular basis as opposed to confirmed cases. Because if I catch it and I don't get sick, does it really matter? And what we're really trying to protect is the hospital beds and being able to treat this correctly. Is that going to change as we go forward?
Hi, Bob. This is Erin again with the Platte County Health Department. And I was just going to add to that we are looking at hospitalization numbers. That is obviously a very key metric that we are taking into consideration. I think we may have mentioned, if we didn't, I apologize, at the last meeting that we have looked at regional hospital numbers, and those numbers of COVID-19 cases in hospitals are going down. And I know that as a region, they're looking at hospital bed counts and keeping very close track of those. Steve Hager, you may be able to contribute more to that, of what they're doing on a regional level. Obviously, we only have one hospital that's even in Platte County, and Platte County residents can go to many different hospitals, so we want to look at that as a whole, as a region, and that's a very close thing that we'll be monitoring. And probably one of, as you mentioned, one of the most important triggers moving forward is making sure that those hospital numbers stay down.
This is Steve. I can say that hospitals report their numbers every single day. and we are looking at what does that look like. I think I spoke on Monday saying that we're very fortunate. We're doing very well in Kansas City because of good leadership being out in front of this and putting the right restrictions in place at the right time. So hospital bed count so far has not been any issue. The hospital's also electively canceling procedures and reducing appointments, and everything else has created a artificial surge capacity as hospitals look to start increasing their services. Again, we're doing a huge public health disservice by not getting people taken care of with their essential requirements. So hospitals are trying to get back up and getting patients in for those essential surgeries and everything else that they need. That will then decrease our true surge capacity because we're filling those beds back up. So we will want to continue looking at it. And I think as we start to relax the stay-at-home orders, those that potentially have not been exposed because they've stayed at home and are more vulnerable could start getting sicker. But I think to Commissioner Wood's statements earlier, people are grown-ups and they get to make those decisions. And so, you know, what we, again, have to make sure is the hospitals have the capacity to deal with the surge once it happens.
Could I make a follow-up comment to that, please?
Certainly.
This is Dagmar Wood with Platte County again. And Stephen, yes, I completely agree. We need to make sure that our hospitals can handle the capacity. And I think I'm in so many meetings, but I think I might have mentioned in the previous, the first meeting that was never an issue as reported by the Mark Mack COVID group, is that we've always had enough hospital beds, ICU beds, ventilators and whatnot. But I've personally talked to CEO Adele Ducharme at St. Luke's Northland just a few days ago, and they are hurting financially because of all of the elective surgeries that have been cut. And you all might have seen that Truman Medical Center has had recently cuts in pay for select positions, and Children's Mercy Hospital just furloughed 575 workers last week. So we can swing the other way, and I understand that's, you know, largely in Kansas City. That's outside your jurisdiction, but in general, we can swing so hard the other way that we completely devastate our healthcare providers that are supposed to be helping us through any kind of peaks. And then we've got flu season coming in the fall. So, I mean, it would be great for us to be able to amp those back up again so that they can be of service when flu season or COVID season hits again or whatever. God forbid this come back, but I think we need to be just in general, just saying a statement, and this is probably, you know, this is outside our jurisdiction. We need to think a little bit more smartly when we move forward.
This is Mary Jo again. Yes, it's just what you said, Commissioner Wood. It's a huge balancing act, so that everybody's, you know, trying to do their best. So thank you for that information. Anyone else?
Dagmar, I'm sorry, Mary Jo.
Yes.
The last part you were talking about church services, and it was muffled. So if you can, the specific thing I was keying in on that I couldn't hear was that a church asked you if they can do this service outside, and the answer was what?
Sure. Thanks for asking, James. Yes, I had a church contact me last night and wanted to know if they could have a drive-up parking lot service. So where the congregants stay in their car and the pastor and maybe the worship team are outside spaced adequately apart. And I said, most certainly. Actually, that's how I've been attending church. And it's kind of fun. It reminds you of days of old, you know, the drive-up movie theaters. And it works quite well. Everyone stays in their car. They use a low frequency, low wattage FM radio station that you can access for a very reasonable price. And I mean, even little kids enjoy it. They're sticking their hands up through the sunroof and, you know, waving at people. And but everybody's protected and safe within the confines of their cars. So that was what our conversation was last night.
And a follow-up, I understand, I read online that the CDC was issuing updated guidance on religious services. And it just said it was in a draft somewhere. I actually looked at the CDC site this morning and didn't see anything new. So if that comes out, not that it's going to change what we do, but it was in the article was talking about, again, emphasizing 6 feet and space and distance as opposed to some of the other issues that other people have talked about. But I guess clearly church service is a sensitive issue with a lot of people. And I know you're going to be conscious of that, and the board will, and everybody will be as we go down that road, because I totally agree that not having church services is unhealthy for some people in itself. So it's the whole holistic approach to physical, mental, spiritual health that you all look at, and I appreciate that.
Definitely, James. And yes, you know, this has been ever evolving from day one. And, you know, the CDC, the World Health Organization, you know, Dr. Fauci, everybody, you know, has learned things as this goes on. And, you know, we're more than willing to look at any new developments, new research that has come out. That's why, you know, remember Monday when we met, it's like this has only been on our radar screen for 4 months. So we're very open to any new information that would become available and that could affect our decisions moving forward. So.
Mary Jo, Jeff Taylor, the City of Riverside.
Hi, Jeff.
Hello, ma'am. First off, I want to thank you and your staff for all the work that you're continually doing on this to try to get us back to good. I've got a couple quick questions. I know that Dan's been burning the midnight oil trying to put the business plan specific stuff into place, and I have a quick questions about that. The first question is that with him working as hard as he is to try to get that out, when can we expect that so we can start helping your marketing plan as well? And then the second question to that is, will the health department provide a template for those plans for businesses to use on what you're looking for as a reopening plan?
Well, I know while Dan's keying up here, I know that, you know, he was hoping to have something out by the end of business today, you know, on some guidelines, but, you know, we're trying to get orders out, prepare for meetings, and it's we're doing everything that we can. We're not whining. We're public health. We can be tough during all these times. But I think I've spent enough time that I've let Dan key up here.
Hi, Jeff. Thanks for the question. I'll get it done as quickly as I can. I would like to be able to promise by close of business, but I don't think I can pull that off. By the end of the day, I will have it completed, but you know, I just want to go through it with a fine-tooth comb and make sure it's, you know, there aren't mistakes in it or misinformation. Actually, the document that Steve shared, and you can see it in the chat. I don't know if you can see the chat window in this meeting, but Steve Hager shared a link to that document, the KC Chamber document. That's an awesome document. I mean, that's good. That's a good template right there that employers can use, develop their plans. We're not going to be reviewing all of the employers' plans. We're going to put that responsibility on them, and I think that's very appropriate. And we will only review plans that the food establishments create, because we regulate those establishments, and we want to make sure that they all, and it's not so much because we're regulating. We want to help them develop plans. We want them to be successful and not have a plan that customers will see and say, you know, I really don't want to go to your restaurant because you don't seem to take this seriously. So anyway, the guide that Steve linked to, I will add that link to our website, and I think that's a good place to refer businesses to. And I will also create a similar document, or it's actually almost created, a similar document, not near as slick, but I will do my very best to have that at the end of the day.
Hey, Dan, I would also say that if you check the 4 organizations' websites that I mentioned, and I was able to pull that off of Casey Chambers' website.
Michael, I see your question in the box. Would you send those messages or questions to reopenplan@platte.com, and that email address is on the meeting agenda? The meeting agenda can be found on the advisory group's webpage. We'll do our best to answer those questions. Hang on just a moment. I'm sorry, I just got word that I interrupted Steve. I'm sorry about that, Steve.
Oh, sorry, Dan. I didn't mean to interrupt you. I was just going to say that if you keep your eye on the Casey Chamber website or any of those groups, they also recorded the webinar that was provided today. And I'm fairly confident that they will be posting that as well if businesses want to reference that webinar and the information that was provided.
Dan, this is Tammy Saylor. I had a quick question about the document that you're going to have ready. Will it address guidance for schools? More importantly, we are looking at having summer school in July, but I'm not sure based on these tiers that that's going to be doable.
Yes, I do have a page in there dedicated entirely to pre-K through 12. That will give you general guidance. The detailed plan, I would suggest maybe the Department of Elementary and Secondary Education may have some guidance. Missouri, I know other states will have that. Does that answer your question? Oh, the question about summer school, yeah, I don't see that. This first, we're in phase 1, or I'm sorry, on May 4th, we will enter phase 2, tier 1. It'll take a month before we can move to phase 2 minimum.
Thank you for that.
Whether or not we move to phase 2 is very, very largely dependent on how seriously people take this and how seriously they continue to comply with mitigation measures. So, you know, we can hope for the best. That's not a good strategy, but we can certainly hope.
Thank you for that.
I'd like to follow up on Tammy's question.
Sure.
This is Scott Monses on the Park Hill School Board. And is in tier 2 of phase 2, would that be when we can go back to school, or is it actually tier 3 that we can go back to school?
Tier 3.
Back to school B.
So I would like to see you all consider that, because our kids we're doing the best we can teaching them with distance learning at home. Some kids are doing better than others, just like you would think, but our at-risk kids, the kids that are on free and reduced lunch, we're really concerned about them, and we need to get back to in-person school, or we're going to set those kids behind at a point where they won't be able to recover. So their whole future could be affected by these decisions that you all are making at the county level. And I know you're doing the best you can. I really appreciate everything you all are doing at the health department.
Your concern and your question. My wife's a teacher, and she's so desperate to get back to school. Sounds crazy, but she loves being around those kids. In tier 3, schools are permitted to reopen. It's going to be a kind of a new, I hate to say new normal, but it's going to be much different. It's not going to look like the way school usually looks in Tier 3. A lot of physical distancing measures still need to be in place, and you're probably going to have to work really hard as a school. It's going to be difficult. The school district's going to have to come up with plans to probably rotate students through the school day. Tier 4 is where we return to kind of the normal look, but still implementing those physical distancing requirements.
This is Tammy Saylor again. Dan, I appreciate that because we are concerned about our students that are doing distance learning, but we're also concerned with our large number of students that are high risk, bringing them back in. So I appreciate everything that you're doing and putting the health and safety first.
Thanks, Tammy. Others?
Yeah, this is Dagmar Wood with Platte County. May I ask a question about the phases?
Sure.
Okay, so my understanding, can you all hear me? I'm getting some background noise here.
Yes, we can hear you.
Okay, so my understanding, and correct me if I'm wrong, we are currently in phase 2. We're looking at triggers for phase 3, and according, I have some questions about the triggers for phase 3. It appears that it says on one of the bottom pages of that recovery phase, there are 3 triggers that could prompt movement into phase 3. One is the availability of a vaccine, widespread availability of effective treatment, and then minimal active cases. So if we're looking at for a vaccine, that might be 1 or 2 years out. Is that something that we are definitely needing to meet that standard before we get out of phase 2 to phase 3?
Dagmar, this is Dan with the Health Department. I think to answer your question, the phase 3 is, as a comparison, maybe the way we are now in the world with influenza. That's kind of when we're back to normal and have availability of a vaccine is a huge difference between influenza and COVID-19. But that's you're right. That's down the road. First, we have to have availability of that vaccine, and treatment is improving. There's a lot of promising treatments that's are improving. But I know this is so difficult for everyone, but we just have to remember we're in a pandemic, and pandemics are really rare, and they have impacts that go way beyond health. There's tremendous negative impacts on the economy, social impacts, political impacts, but the only way to get the economy rolling again is to end this pandemic. And we need to do it as quickly as possible. And I know a lot of people would like to just throw open the doors and say, hey, we're back to normal, and hope for the best. But frankly, that's a terrible strategy. And that's why we have to do, and I know you get that, but that's why we have to do this slowly in phases and meters. And I know I've heard and seen tremendous amount of anger and really offensive emails to Mary Jo. And what's bothersome about that is that Mary Jo and the Board of Trustees didn't create this pandemic, but they're being very responsible and very responsive in how they move forward. And I don't mean to my soapbox here, but I just think it needs to be said. We're in a pandemic. We have to remember that this is not life as normal.
And this is Dagmar again, and I can completely appreciate that. Like Mary Jo said, this has only been on our radar screen for months. So with one of the other issues being an effective treatment, personally, I believe, and I'm not a healthcare professional, I just want to put that caveat there. I would think that that would be much more important, available treatments, than a vaccine, because we are finding in recent studies, there's 2 in California, 1 in Delaware, and 1 in New York, and it is looking like this is way more pervasive than what anybody had thought. Anywhere from 15 to 55 times the people are infected than what was originally thought. And if that's the case, really, a lot of them are asymptomatic or have extremely mild symptoms. So then we're getting into, you know, we want to make sure our hospitals, we have enough capacity for that. But I mean, that seems like we're beyond a vaccine. But that horse has already left the barn. The treatment is what we're needing for those people. And if this is really as, and these studies are in 2 California, one's in Newcastle County, Delaware, New York. So these are their own numbers, is that this is so pervasive in terms of what the percentage of the population is, then we are on our way to herd immunity is what it sounds like, which may even occur way before a vaccine even happens. So I want to think about this and I know you all are too, about a bigger picture perspective, what's happening on the outside, and maybe instead of requiring a vaccine to be discovered and administered in our county or even in the nation as a trigger in order to be able to get back to normal, which may not be for another year or 2. I think we need to think about these things as well. And to one of the earlier points, trending hospitalizations are way more important than the number of cases, because as we've talked about before, when you increase the number of testing, you're going to have the increase of the number of positive cases, and many of those are asymptomatic, and they're just, they don't even touch our healthcare system.
Thank you, Dagmar. This is Mary Jo again, and you know, the bulk of what is in this plan, including what you're referencing, the triggers, you know, that comes from the national plan. So not only did we not create the virus, the plan is something that we're all, as the world, the nation, you know, are trying to come up with. And as I keep saying, you know, this has been changing from day one. Just like, remember the days when the CDC was saying, no, there's no need to wear masks when you're out and about. And then all of a sudden one day it's like, oh, yes, we do recommend that you wear masks when you're out in public. So, you know, we'll just have to stay vigilant, stay informed, and do our best, which is what we ultimately are trying to do.
Mary Jo, this is Steve.
Yes.
You know, I might just say, again, the hospitals have been doing very well on bed counts and everything. And again, most of that has been because we've canceled those elective procedures or even essential procedures at this time. As we start to reopen, bed counts could become more of an issue if we start to see an increase in severity of individuals who are getting sick. So right now, one could speculate that the majority of people getting sick with this and have very little symptoms are those who are much more mobile and out there in the community already. Those who are most at risk of being sicker are staying confined. If that changes, that could change that bed count. But as a general rule, most of the hospitals in the Kansas City area run at or near capacity a lot of the time. Now, especially during flu season. So this is, you know, going to be different as well. We're out of that flu season time. And so as we reopen, we will start to still have more capacity because of that. But you know, if we see a second wave in the fall or something that aligns with flu season, that could be that problem at that time. So, but you know, to everyone's point, the economy has to get going, but we want to make sure that again, we're not doing things too quickly that are impacting the ability to provide adequate health care.
Thank you, Steve. Very well articulated. Anyone else like
Mary,
to comment?
I have a comment, Mary Jo.
Hi, James.
Hello. One thing, I'd like to thank all of you, Mary Jo, Dan, your entire group of folks who are doing this, because it's seemingly insurmountable work to get at something that's nebulous at best. And I know it's hard, and I know you get a lot of criticism, but I know you all are doing your best and take the best interest of everyone to heart. And I personally really appreciate that. When you update the plan, a recommendation, instead of going by incubation periods when you specify that in transitioning between tiers, use actual a month or 2 months. That's clear to people. They don't really understand sometimes when you say 4 incubation periods, that's 2 months. So a recommendation when you update the plan, you kind of put it in terms people can understand, because it helps them understand better and realize that 3 months is 3 months. And that puts things in stark perspective sometimes.
Thank you for that viewpoint. You know, sometimes it's hard when you have the awareness of the terminology. It's helpful to have someone say, we need to bring that down to the level that the public can understand. So I appreciate that. Not that we're at any levels. Don't want anybody to think that, but and I just want to say, I'm very capable of handling any kind of emails, negative, positive, that come at me. Dan wasn't paid to make that comment. I just want you all to know who are grateful that we have moved our date up. One of the very first emails that I got last night made the comment that they were very disappointed in the Platte County Health Department, and thanks a lot for putting their lives on the line and caving to economic and political pressures. So I'll take time to respond to that person tonight, but you just can't please all the people all the time, and we're in the business of protecting health and protecting people, and that's hard to make everybody happy when you're trying to do that. But I have a great crew here, to stand beside me and with me. I appreciate my board tremendously. We've never been this far before, as the old song says. And thank you for your comments, James.
This is Scott Montes. I just want to say thanks again to everyone at the health department for all the hard work you're doing. I do want to say that I'll support you as long as you're rational and reasonable and continue to make good decisions that fit with the current risk level that we're at. I do want to stress that I shared a document with the group about hospitals being in conventional mode, contingency mode, and crisis mode. And I just want to stress to the folks at the health department, right now our businesses are in contingency mode. That's what I'm at for my work. My contracts have been cut 50% for some of my clients. And crisis mode for many of these companies. We already know Zona Rosa is going to lose some members, tenants over this. So I know it's a fine balancing act, and I know you all are doing your best. And I just want you to know that if the tide shift, I'll shift my attitude as well. And I think some of these things of getting back to normal, some of those are a little harsh. I understand they're coming out of the feds, but we just need to be flexible. And you all really do seem to be flexible and taking the best interest of Platte County. So I really appreciate everything you all are doing and the way you're making decisions.
Thank you, Scott.
And this is Dagmar with Platte County. I would agree with that. I appreciate, Mary Jo, how you have made yourself available to so many people that are may not share the same viewpoint as you, and you've handled yourself well, and you're going to get plenty of emails, so you'll get thicker skin, and you'll be thankful for it.
Yeah, I hear you, Dagmar. We'll talk someday. We'll have lunch, and I've been through a lot of things in my life that have thickened that skin, and I think by the time they lay me to rest, I'll have something like elephant skin. But that's all right. I've come out of all of it a better person on the other side, and we talk a lot about resilience. That's one thing to talk about it, but when you live it, and then you grow your resilience, on the other side of that mountain, it all, you can all. Your trajectory, in life can be altered in positive ways as well. So we'll all get through this together. This is a great county. I mean, Commissioner Wood, when I met with you guys that very first time about COVID, I said that Platte County is an awesome county. And I've worked in this county for over 22 years, and they just continue to show me, what a great county that when we've needed them to come together or, for different events, our Day of Hope, just different things. I'm happy to work and proud to work in this county. So thanks for everybody being there for each other. Having said that, if other people have other comments, feel free to chime in, but I was just wondering about when we want to meet again. Do you want to meet weekly? Do you want to meet more frequent than that moving forward? I just don't want to meet. I want it to be useful of everyone's time. Can I have some feedback from the group on that?
Mary Jo, quick question with that. Do you see changes coming this week that we would need to meet again Friday? Or do you see this as we can now push this out to the first of next week before we have further discussion?
I think that would be more reasonable, give us some time to digest some additional documents to review and, have something to report by then. What business needs are out there. Hopefully there might be some guidance on that funding from the commissioners. Like I said, I want our meetings to be meaningful when we are taking folks' time. So okay with the rest of the group that we would maybe meet next week? How's that?
That's
Yes.
Yes, I think next week would be fine.
I think I've heard a few folks say Tuesday of next week. How about Tuesday at 1 o'clock again? We will reconvene and send us any information in the meantime, and we will talk to you all then. Thank you very much for the time that you've given us today, and stay healthy, stay well, and we will move forward next week. Thank you all.